Hi, my name is Laura Cartwright. I'm the staff development nurse at Nazareth Home, and I'm going to talk to you guys really quickly today just about once weekly Trulicity injection. So we'll just start with what it is. It's a once weekly injection that helps the body release its own insulin when glucose increases. So our glucose increases when we eat. So every time that we eat, it's going to help us release our own insulin to combat that instead of having to use insulin artificially. So it's really only for people with type 2 diabetes. It is not insulin itself. So this is what we want to use for people who are type 2 diabetics, who don't yet require insulin, but who progressively may need it in the future. We're going to try to keep them off of insulin as long as we can. So it's available in 2 different doses. You have the 0.75 and the 1.5. They usually start people on the 0.75, and then if that's not doing its job, then they'll up the dose. It can be taken with or without food, which is a little bit different from insulin. For insulin, we're going to take their blood sugar before they eat and cover with the insulin, so we wouldn't do that for this. So you can take it with or without food, and it can be administered any time of day or at night. So that's a little bit different too. It won't affect residents who have end-stage renal disease. It's supposed to be stored in the refrigerator, but it can be out for up to 14 days. So just make sure that if for some reason we can't give a dose or something's going on, we want to make sure it's in the refrigerator and not out for more than 14 days. We give it once per week, and 1 full pin is actually 1 dose. So after you administer it, you just throw the entire thing into the sharps container. So the most common side effect that was reported is nausea. About 1 in 5 patients reported that they had nausea during the clinical trials, but typically it didn't last longer than 2 weeks. So this is a once weekly injection, so at most they had nausea for the first week and into the second week. Some other common side effects they're all GI related. They're all going to be gastrointestinal. There's vomiting, diarrhea, abdominal pain, decreased appetite, dyspepsia, and fatigue. But residents using Trulicity may also get a little bit of weight loss, mainly because it causes a decrease in appetite. So we're going to watch real quickly just how to administer it. Use the Trulicity pen. So it's going to look like this. It'll have the dose written on the side. This is just the demo pen. On the back you'll see the lot number and you'll see an expiration date, so we always want to check for that just like normal. But if we're ready to give it, of course we would prep the skin site. We would make sure that we've alcohol swabbed that, because this is a sub-Q injection. So the first step is you pull off this gray piece and discard that. Then you're going to see up here there's a little lock and a little unlock. So we want to push this over, twist it to unlock. So then the next thing that we do is, this is someone's skin, we're going to push this right up against there. We're going to click the green button, but we're going to wait 5 to 10 seconds. And you'll hear that second click. So I'm going to do that again, just so you can see what it does. So we switch to unlock, and then when I click, I was going to give it here. I click, you can see it start to slowly drop. And then we get that second click. That's what we want to wait for. Okay, thanks. All right, well that concludes our little demo of the Trulicity pen. If you want to come practice with the pen, it is available down in the education room, just if you want to get more comfortable with it. I think they're super neat, but if you ever want to come see it, it's right down here, so just come on by. All right, thanks. Y'all have a great day. Bye.